Hi folks, Ross again from OpenAirway here in the UCT Anesthesia Airway Skills Lab, and this short video is going to look at the technique for using the Fastrach intubating LMA. So there's some good videos out there and there's lots of literature on this, and I think this is an important device that you need to know. As always, these videos are made off the cuff. There's room for improvement, I'm sure, so if you want to put critique and comments in the comments boxes, please do so. So, the Fastrach is a device which is designed to allow one to obtain an airway using the supraglottic airway in a difficult intubation situation, and then intubate through it blindly using a specifically designed endotracheal tube. It's important to recognize that using the Fastrach's own endotracheal tube has been shown in the literature to have a better success rate than using any old tube, because of the way that it's tapered, because of the way that it's designed. The specific features of the supraglottic airway portion of the Fastrach, you can see it's got a rigid handle which allows me to manipulate it, which will be clear in a moment. It's got this sort of J shape and a very specific fixed curvature. It's got an epiglottic lifting bar which helps to lift the epiglottis out the way as the endotracheal tube comes through it. And it's designed so when the endotracheal tube comes out, it comes out at a specific angle to go through the glottic opening. So, how do we use this kit? You're going to need the appropriately sized Fastrach with its endotracheal tube, and then there's a push rod for removing the supraglottic airway portion, and of course you're going to have a method of ventilating your patient. The sizes are 3, 4, and 5, and they're sized according to ideal body weight as with the other supraglottics. So, in my situation, my difficult airway, perhaps the sats are dropping, perhaps I've failed my intubation, I'm starting to panic, I grab my Fastrach, cuff deflated, well lubricated, inserted like I've been describing with all the other supraglottics, following the curvature of the airway, in it goes, and immediately I can connect my ventilation, I can inflate my cuff, and I can see, am I able to ventilate? There we go. I'm oxygenating my patient, sats are coming up, my heart rate is coming down, and now I can relax and start to think about my next move carefully. So now, I'm going to perform what's called the Chandy maneuver, named for Chandy Verghese, who describes, and I'm going to move the Fastrach backwards and forwards in the sagittal plane like this until I obtain the position with the optimal ventilation. Right, there I found it. Now the second part of the Chandy maneuver is that I'm going to lift this whole device as if I was lifting with a laryngoscope to bring it into good apposition with the glottic opening. And then I'm going to pass my endotracheal tube with a black line that's on the tube facing towards me. This is all nicely described in the product literature, and I'm going to advance it. I often feel a slight moment of a hold up as it goes through the vocal cords, and then I can inflate the tube's cuff and I can start to ventilate. And there it's in. Now the situation is saved and resolved and my patient is safe. If down the line I want to remove this rather rigid supraglottic portion, then I can use the push rod. So I pop out the endotracheal tube connector and put it where I can reach it and where I won't lose it. I use the push rod to hold the ET tube in the same place while I'm bringing the supraglottic airway out, following the curvature of the airway once again. As soon as I can grab it, the tube, I hold it there, and then importantly, you need to remove this push rod so that the pilot balloon can go through the LMA portion, put your connector back in, re-inflate your pilot balloon, and then we can ventilate again. So that's Fastrach intubating LMA, a very, very useful device. And studies have shown LMA placement success with this device approaching 100%, intubation success, depending on the study, in the high 90s. So a very, very useful device.